I've been lucky enough to be working on and off at the Women's Centre since 2008, initially as a trainee and now as a consultant for the last 5 years. And it feels like a family here. So everybody here works incredibly hard to make an amazing atmosphere to provide excellent women's health care. I've been a patient myself here, both in gynecology and in obstetrics, and it is absolutely a fabulous place to be a patient and to be a member of staff.
I chose to come to John Radcliffe because of the experiences of other people I know who worked here, and they saying how amazing it was to be a midwife. So I enjoy providing care for a variety of women and families across the Oxfordshire county. I'm now in the practice education department and providing lots of different facilities for all our midwives here at the Trust.
I've been here since 1998 and a consultant since 2001. It's been an amazing pleasure and an honour to work in a unit like this and to have, I hope, made a contribution to its excellence. It's a really good unit. It's got a fantastic culture, if you like, a really good relationship between doctors and midwives. We're one of the busiest units in the country, and we have been for some time. And I think that we should be celebrating our 50th anniversary because we're a good unit, and I hope we have another 50 years of such good results and quality.
I started working at John Radcliffe in November 1989, and I came as a newly qualified midwife, really excited about coming to Oxford. I've worked with lots of midwives, MSWs, lots of people I've seen come and go, and it's been great. Certain people I've seen started when I did and they're still here, and with a few of us are still here. And to work in this unit is lovely, it's just like my family.
Since joining the team in October as a Deputy Director of Midwifery, I've really enjoyed how welcoming and friendly everybody is. I mean, I've worked with so many fantastic people, the leadership team, the midwives, care assistants, nurses, housekeepers, admin staff, everyone's just fantastic. So it's a huge congratulations to everybody.
I began working with maternity in 1970 when this hospital didn't exist, and I was working down on Walton Street where the Radcliffe Quarter is now, but the old Nuffield maternity home was. At that time this building was being prepared and it opened in July 1972. The old maternity home was very compact. This was vast, so much space it was hard to know where things were, where people were, and so on. Right at the beginning there were two maternity units in Oxford, one at the Churchill and one here, and they were combined when this hospital opened. A huge advance of what had gone before. Then in those days there were no laboratories up here to do the standard blood tests, so they had to establish a special one from down in the Radcliffe Infirmary. There was no canteen, so they had to establish a special one, which was all of our own. So we were here, a very privileged group in our nice new hospital, the first of the John Radcliffe complex, and I have to say, morale was very high. We were all together, we all had lots of space, and it was good fun. When Princess Diana visited the unit in 1986, she was opening the unit which was funded by Birthright at the Royal College. She loved talking to the mothers who were all lined up outside the front entrance. She loved talking to anybody who had a baby or something human.
My name's Desi Choi. I'm a consultant anaesthetist and I'm the clinical lead for Obstetric Anesthesia. So obstetric anaesthetists are doctors who look after people having an anaesthetic for surgery, operative procedures, and specifically around the care of women during childbirth. This year we're celebrating 50 years of the Women's Centre, or the JR1 as my more senior colleagues used to call it. So I'm really proud of working here. I've been a consultant anaesthetist in Oxford for 20 years now, and I'm proud of the expertise and the dedication to providing compassionate care and maximising safety by what is a very wide, massive, multidisciplinary team. So I'm really lucky to work with colleagues, obstetricians, the midwives, all my other anaesthetic colleagues. We've got theatre staff and the ODPs. We've got the maternity support workers, the porters, the domestics, the neonatologists, the ward clerks, and people I'm sure I've forgotten. Everyone works together. It's really, really good teamwork. We now have 5 operating theatres, so there are 2 gynaecology theatres and 3 maternity theatres. One of them is the newer one, which is dedicated to the care of women having planned caesarean sections. I had my son here, so I'm just really grateful to the care of the staff at the Women's Centre during one of the most important times of my life.
I started here in the summer of 1994. So when I started here, I was a fairly junior registrar, and I was working in a department that was much, much smaller. There were many fewer registrars on duty in the whole of the rota. So I think there were 3 other registrars at the level that I'm at now, and I think there are probably something like 16, another 16 at the higher level. So I've been a consultant here since 2001, and I was appointed substantially in the winter 2002, and I've been working as a consultant here ever since. And 2 years ago I became clinical director of the maternity department as well, but I still work as a consultant. So I'm just amazed with the consultants who work here, and it's really wonderful how committed that they are. But also we have lots of other doctors working at different other levels, and also consultant anaesthetists who are particularly committed and really fantastic part of the team. And then of course it's a huge department with hundreds of people working in it, loads of midwives working within the Women's Centre but also outside, and the midwives are all amazing people. It's wonderful when they're coming on at night to see the enthusiasm with which they arrive to do their duty. And then of course the other thing that makes the NHS work is all of those people who work in non-patient facing roles, and the whole service wouldn't work without them. I think we are really lucky working here and with the people that surround us. So we have to look back at where we were before the Women's Centre opened, and when the Women's Centre opened, that was the first building on this site. The journey that we've gone through, the level of expertise, the things that we can do now are incredible. And if you think back, there was no such thing as ultrasound then, for example. What I'd like for us now is to be able to offer care that's not only good and safe, but also a little bit easier to access for the women and a little bit more comfortable when you're here.
It's a great landmark. Having 50 years of this building and the services this has provided, the countless number of mums, babies we've looked after, it's an opportunity to say thank you to everyone. And I'm just not saying thank you to the clinical staff, but the staff that makes the whole place run. It's our ward clerks, it's people in the background that you don't see, who make sure that we're able to do our job. So a big thank you to everyone who's been involved. It's an incredible journey. We've carried the baton to now. It's our duty to carry on for a few years. We look forward to the next innings.
And congratulations to the John Radcliffe on the Golden Jubilee. Thank you.